Okay, we're going to talk now about different pathologies that the patient might come in with their hip, different types of hip lesions. And it may be anything from an infectious process. It might be labral tearing, maybe degenerative changes, maybe ligamentous tearing like the ligamentum teres, etc. But there's some type of a lesion, something's going on with the patient's hip, and so we're trying to figure it out. So we're going to start with Patrick's test, and what we're going to do is we're going to bring the patient's knee up like this, and what we're going to do is ask the patient if that causes them any pain. And again, any time during these tests that it causes the patient pain, you'll ask them, where is that pain? And they should be able to pinpoint right into the hip. So if that doesn't cause them any pain, we're going to telescope into the hip and ask the patient if that causes them any discomfort. If that does not, we're going to abduct and flex and externally rotate, and we're going to ask the patient if that causes them any pain. And if they say yes, again, it's where. If that does not cause any pain, then what we're going to do is we're going to push down on the knee, stabilize the opposite hip, maybe add a little pressure actually through the femur into the hip, and see if that causes the patient any pain. The next thing we're going to do is we're going to do what's called Laguerre's, and they call that Faber in the air. So again, this one is more of a nice, steady fluid movement test from beginning to end. So you could say to your patient, at any time this causes you discomfort, please let me know. So what I'm going to do is I'm going to reach down with my superior hand, and I'm just going to grab onto the ankle, and I'm going to bring the patient's leg up like this. And as I'm bringing it up, I'm going to turn around this way, and I'm going to add pressure down with my elbow and stabilize the opposite hip at the same time, and ask if that causes the patient any pain. I hope you can see that. Next test we're going to do is called the scouring test. And the scouring test is primarily used for a labrum, but of course any type of lesion here would come out positive. So what we're going to do is we're going to take the patient's leg and we're going to put it into various degrees of hip flexion. While we're putting it into various degrees of hip flexion, we're also going to do varying degrees of external and internal rotation and adduction and abduction, all the while we're adding some pressure down through the patient's femur. So it'll look somewhat like this. I'm pushing this down in. I'm literally scouring the acetabulum with the head of the femur. So that's what's taking place while we're doing this. And you're going to ask the patient if that causes them any discomfort.